How you doing, guys? This is Kento at Kamiyama Physical Therapy, introducing you to this neck webinar. The webinar is called Freeing Up the Webinar. We did catch a lot more people this time around. People are more interested about the neck, especially during these times where you might be on your computer a lot more, where you're kind of looking to your computer a whole lot more, and you might be sitting a whole lot more. You might be exercising throughout the day just to get out of the quarantine, and you just walk outside and do bike outside. But, because of all the stress and everything else, you are likely having some sort of a neck tension. So we discuss about certain concepts that could lead you to freeing up the neck a little bit more. So we have some self-assessments that you can do, and by learning and becoming aware about how you move your neck and how your neck is in relationship with other things in your body, you might learn a couple things from it. So enjoy the webinar. Talk to you soon. Hi, this is Kento at Kamiyama Physical Therapy. Welcome to our channel. We've been doing kind of webinars since the quarantine every week now. We kind of just first started as kind of something to just share because we've been trying to think about webinars and kind of about the community and where we're practicing in Tenafly, New Jersey. But it's kind of, we just kept on going with it, and it seems like at least it's somewhat informative to some people. So we're just kind of continuing. So thanks for coming. It's just a nice excuse to see some of your faces. If you're coming in right now, make sure you're muted. If you can, kind of turn the webcam on, because if it's someone you haven't met before, or if I've seen you before, I would just love to see how you guys are doing. Yeah, we're started. So today's about freeing up the neck. We are gonna, whoa, give me 1 second. Let's go this way. Okay, cool. So today we're going to bring up the neck. So Danny's going to talk a little bit about the anatomies of the neck, common patterns and compensations. But then I'm going to start talking into kind of how to self-assess yourself a little bit. I can't give you everything. Assess it. See how your neck is in relationship to someone else. John, I just need to mute you for a second. I see John. Give me 1 second. There you go. All right. Just make sure you guys are muted for those that are not speaking. So the freeing up the neck is going to be something. So we're going to do a little self-assessment. Sorry, I'm going back. We're going to do a little bit of self-assessment at the end and see how your neck works in relationship with other parts of your body parts. So we're going to talk about certain concepts within that, how we see or how we see as Kamiyama PT, how the neck works. So hopefully it kind of sparks some ideas for you all. Along with that, hope you guys are doing okay or well. I hope everyone's safe, hope everyone's healthy during this COVID-2019 times or COVID-19 times, because it's the 7th week of quarantine, so it's kind of crazy. I'm drinking coffee more than ever, even though I don't need to drink coffee, especially.
And wine.
And wine. I'm drinking a little wine every weekend. And I'm not a drinker, but I'm drinking a little bit more than usual. So there's a lot of different things happening. So, we'll love to know what you guys are doing to deal with this. You can put it in the chat too if you don't mind sharing. And let's get started. So if you are kind of stuck in home in pain and tired of being in pain, we definitely want to keep you if we can help, we would love to help because we've been giving out kind of virtual complimentary sessions today. We've been giving out kind of these expertise consultations for individuals. Danny just got kicked out, I think.
Yeah, technical difficulties. I don't know what happened.
But we'll keep going with it. So we offered kind of virtual complimentary sessions in the past several webinars. It was a lot of people already kind of signed up for it, and it was so valuable. And we're just going to stop it, but we're going to kind of continuing. So for those individuals that that could use some form of help, professional help, contact us, and we'll be more than happy to try to get in contact with you as soon as possible to see if we can be of help. So don't kind of hold, or my father just took a long time to ask for my help for back pain. So don't be kind of like my dad, where he waited for 4 weeks while he couldn't walk. And it took him 4 weeks to actually ask for help. If you can, ask for help early, even if it doesn't have to be us, have anyone that you can, and ask for help and, get better. Like, don't get stuck at home not being able to do stuff that you want to do. If anything, this is a time to work internally. So let's get started with the webinar. We are gonna talk about the neck, but a little bit about myself for those that are joining for the first time. My name is Kento. I am the owner of Therapy. We practice in Tenafly, New Jersey. I used to practice in New York City as well, and I miss my New York City people. I enjoy the individual holistically. So I'm a clinician, but I'm also I'm a teacher. I'm a lecturer. I've taught seminars in the past where I enjoy teaching. But from the reason I like to teach too is when I see an individual, I don't just treat the individual with their body part. So if the person comes in, let's say for today, neck pain, I don't just look at the neck. I try to see how the neck relates or works with other parts of the body and the reasoning behind that. So it's really important to understand it's not just the neck that's involved. Many times there's a couple different things that it gets involved that could lead to pain. I love reading. I love enjoying kind of going deep into topics. But most important right now, especially with the time given, I enjoy spending time with my two kids, Mia and Kay. This is not the first time you see the picture, but when I'm doing push-ups, my daughter always kind of bothers me. She'll kind of say, "I'm going to exercise with you," and it's really just her going on top of just doing all the exercises. But it's a great time. My son's picture there, so just having a great time with the kids right now. I'm going to hand it over to Danny. Danny's into his intro and kind of start the webinar.
Thank you, Kento, for the introduction, and I love your kids too. They're so much fun. So my name is Danny Urbano. For those who don't know me, I'm a physical therapy assistant, and I'm also a licensed acupuncturist in New York. I am lucky to be an adjunct professor for St. Paul University for the anatomy program for both the physical therapy and physician assistant program. I think it's something that I share with Kento too, is the fact that that I don't look at the body just like as just one region. The body has a connection with from top to bottom. So we love to look at the whole as a body as a whole. Just like he was saying, it's not just about the neck, it's about the neck and the connection with the hip, with the foot, with the shoulder. A little bit about myself, I love working on cars. I think that's like a little bit almost like working with the human body. Like I just love like that, to investigate and trying to find out what's really going on. And of course, I love spending time with my wife. But let's enough about us, and then let's get into the presentation. Of course, the neck is going to be the topic for today. But so at different points in our lives, like we all had that annoying neck pain. We all remember waking up with that twisting, nagging pain after sleeping in a certain way. It's just like there, right? Sometimes we had that neck pain after a long day at work. Maybe that pain came after cleaning the house, running errands, or playing with the kids. Sometimes that pain went away, but most of the times that pain was lingering for weeks. And sometimes you might have, even right now, you might have some neck pain, right? So what do we do when we all need answers? We go online and look for exercises and devices that promise like that instant relief. Sometimes they offer like the second device if you buy now and pay shipping and handling. We all know those commercials, right? But the truth is that those things don't usually work, right? And they create more frustration, right? So what Kento and I commonly hear in the clinic is a frustration and that fear from those suffering from that neck pain. A lot of those feelings really come from not knowing what is happening and not knowing where it came from. So we hope at the end of the webinar, we can show you enough information so you can understand what is happening and know what you can do about it. So let's get this party started by showing you a little bit about the index, what we're going to be discussing. Of course, we're going to go over anatomy, bones and muscles and ligaments, some basic concepts. We're also going to discuss the relationship between the neck and the rest of its body, especially along the rib cage and pelvis. Of course, we're going to discuss about injuries, posture awareness, and so self-assessment that Kento is going to show you later. So, like promised, this is the neck. You can see the picture in here. The neck is this whole area. I'm going to try to highlight a little bit more here, from here to here, right? So it's formed by several vertebral bodies, so 7 bones. And specifically 2 of those bones, this one and this one, they have a unique shape. that allow for rotation and flexion. Rotation meaning when you say no, and flexion when you say yes. So those two special kind of like specific shape that they have. But the main function of the neck is going to be to provide that support for that head, allowing for like the multiplanar movement. So like side to side when we reach, when we go like down and up and all of that. But another function is to protect the spinal cord, which is going to travel right inside the spine, and also to protect major blood vessels that go along to the brain. All right. So let me take that away. Let me show you the next one, the next structures that support that, which is the muscles. Now, the muscles and ligaments. So the neck is going to be supported by muscles in front, as you can see here, in the side, and in the back. So you can see there's a lot of muscles going from the front, from small to big to really, really big, which is this muscle in the back. Now, something interesting, interesting fact about this is that the muscles that create that big movement for the neck and the muscles that assist in respiration, they actually attach to the rib cage. What are those? So let me show you. The first one is something called SCM, which is the abbreviation, which is this muscle right here. In this big here, it starts in the back of the head or on the side of the head, and it attaches to the clavicle and the sternum, which is the bone in front of you right here. Another big muscle that helps you to bring the head back and kind of shrug the shoulders a little bit is going to be this muscle called traps, which you see here. It starts in the back of the head and it attaches to around the mid back. Another muscle that's really important is called the splenius. There's a few of them, but you can see one of them in here, in this side in here in the top left. That muscle also helps you to bring the head back or extend the head and a little bit of rotation. Something else that helps you is called scalenes, which is going to be these muscles right here in the side of the neck. It's going to be 3 of them. They help you for respiration. They actually start like in a really high up here at C2, and they actually attach to the rib cage. So I want you to remember that, but I also want you to note that the neck is also supported by ligaments. They start around the neck, but they also run along the whole spine. So what does that all mean? It means like the neck has a lot of connections with the rest of the body. It is in constant communication with the rest of the body. So there's no way to isolate that neck. All right. Now I want to show you something else. Let me erase this. So what does that all mean? So I want you to think about the neck like a tree, like we can see in here. Now I want you to think about the muscles that I was showing you, like roots of that tree. Now I want you to think about that rib cage, those first ribs and all of that the neck, those muscles were attaching as a ground. So I want you to see like the neck is almost like a tree when it's round, that it needs to be properly grounded so it can, like a tree needs to grow, it needs to expand and all of that, right? So the neck also needs to be grounded. But what happens when a tree is not properly grounded? It's going to start to grow crooked. So you can see in the picture on the bottom right, this tree was kind of like was growing in the edge of this piece of land, and you can see how it's growing crooked. If you take a picture on the top left, we can see that something happened along this earth, and then it was like there's a lot of erosion, and the land was kind of taken away. So you can see that this tree is actually starting to die. Not to say that something happens to your neck, you're gonna be dying, but it's just gonna tell you that the neck needs to be properly grounded or needs to communicate with the rest of the body so it functions properly. Because when the neck is not properly grounded, it would develop compensations, leading to injuries. What are those injuries? Of course, it's gonna be neck pain. Of course, one of them. But something common that can happen is gonna be headaches. It's a headache that is gonna start in the back of the neck, that may kind of radiate all the way to the front of the head or the side of it. Sometimes it's one side, sometimes it's both. Injuries can also present as herniation or stenosis. Sometimes that herniation or stenosis it can be a local pain in the neck, but sometimes can affect other structures, such as the shoulder. Why? Because the nerves that come or feed the shoulder, they actually come from the neck. So you can start seeing some shoulder issues or some grip issues if you have something going on in the neck. Something else that may happen too is something called TMJ. You know, that the jaw, which is the TMJ, is the jaw, is a structure that connects to the neck, and it is a constant communication with the neck. So if the neck is not properly aligned, you're going to have jaw issues. So what are the factors that can contribute to those injuries? Let's go over that. So we all always looking like for that good posture or that perfect posture, right? So if we take a look at the picture on the left, it's almost like, the optimal posture that we are looking for, right? It's almost like if you take a plumb line from the top all the way to the bottom, and if things are distributed properly, the body will be working perfectly, right? But, we'll have to work in front of a computer and sitting, and then we're not moving as much as we should. So what happens? We start to develop bad posture, right? So in this case, like, this is an example. Like sometimes when we notice that we're slouching, sometimes we start bringing our shoulders back. Just because we're bringing our shoulders back does not mean our posture is gonna get fixed. Something that you can see, actually, I want to show you in this picture, and Kento will discuss a little bit later, is that once that line is a little crooked, other structures such as the pelvis, such as the neck, such as the mid-back, they're all going to start moving in different directions. That's to show you that, that they all communicate one way or another. All right, so of course, the picture on the right is going to be like the common slouching posture, but you can see that more that you slouch, that more that things are moving out of alignment. Again, the shoulder is out of alignment in here, the pelvis is out of alignment here, and of course, you can see all the compression that is happening along the neck. You're going to hear a little more from Kento about that connection between the body. But before we go into that, let me show you some other common patterns, right? So they're going to be something that we often see in the clinic is something that Kento and I call lazy low back. What is it? It's something that's going to come from the pelvis, leading to a low back issue that later becomes a neck issue, or vice versa. Meaning, sometimes when we have an issue along the pelvis that's not properly aligned, and is it crooked forward, to the side, or compressed, now that's going to lead to a back issue. Once we start having a back issue, we're going to start moving in different ways to try to compensate, try to get away from that pain. As we keep compensating, what's going to happen is that the neck is going to start picking up that slack or compensation. So you're going to have neck issue. Or sometimes you may start with a neck issue, and because you're trying to find that angle so it doesn't hurt, your back is going to start hurting because you're all twisted. Something else that we see in the clinic is tensing up the neck when lifting or doing overhead work. Meaning when you're trying to put the groceries away, right? When you're trying to put something above your shoulders, above your head, what commonly happens is we're going to overextend the neck, meaning we're going to use the muscles in the back of that neck to get that extra power to try to get lift. Sometimes we get that extra power by hiking that shoulder and compressing that neck even more. So you can see all the tensions that might start to build up in there. Something that we all face is that stress, right? If we just work for the perfect job, of course, we're not little to stress, but every job has its level of stress, right? So if you're lucky to just work for 8 hours, right? So imagine 8 hours having your shoulders all tensed up and your neck all tensed up because, whatever it is that you're doing. So if you keep that for a day, maybe it's not going to do a lot of harm, right? But if that stress stays with you for weeks, months, and years, you can already imagine how much damage is happening around the neck. Like a little, in summary, right? So you can see that the neck is a multiplanar joint that compensates for other joints, meaning the neck moves a lot, right? From from saying yes to no, to side, to reaching, to trying to, like, look in other angles, right? So it moves a lot. But because it moves a lot, it's going to be an unstable structure. And then something interesting too, that is, like, since it has a lot of communications with other parts of the body, it's always gonna like to do more than it can, right? Meaning it's always gonna like to take over or to try to pick up the slack from other structures, such as the back, such as the legs or shoulders. So it's almost like a little dog. No offense to anyone who has a little dog, but how you see how the little dogs sometimes, they think they're stronger, bigger than others. The neck is similar too. The neck is more structured, but it likes to do a lot. And it has like a lot of communications with the rest of the body, which you're actually going to hear from Kento. So let me pass it on to Kento so he can explain a little bit more from that. You got it, Kento? Hello?
Sorry. All right.
Yes.
You guys should be able to see mine now.
You get it?
Yes.
Perfect.
All right. Thank you, Danny. Thanks, Guy. Thanks, Guy. We are going to go into, in a little bit, we're going to go into the self-assessment aspect of things. But we're going to first continue what Danny said a little bit, just to repeat, because the neck is so complex, at least in my brain. It's not hard, but there's a lot of things involved in it. So there's more complexity behind that. Because the neck, here has a lot of different things. It has the throat, it has the airway, it has the tube that goes into your stomach. There's a lot of survival structures, like essentials for survival, that's including into it. So the brain will do anything to really protect it somehow. So what Danny was saying was very true, at least what we see, is it often compensates for a lot of different things, or it protects it. So Danny was kind of saying like how the shoulder can be affected, or when you have a back that is not in the right position, it will affect the neck as well. Because the neck, like how he talks to us in the Chinese medicine thought process, is where it does well when the ground, such as your rib cage or things that is under it, is well grounded or aligned, or however we want to put it in this case. It does really well because it relaxes now. But when those things are not working, it has to stiffen up to protect it. So it's very often the neck is involved with something else. It's rarely just on its own. You may feel like it's just on its own, but it's often in relationship with something else. So those things that are commonly involved are the rib bones or rib cage with breathing. So if I say it differently, it involves with your breath. How many times, or at least as a clinician standpoint, we often see people with neck issues do have some issues with their breath. So for example, I don't know if you guys see me so well, because for me, I'm in a small little monitor here or screen, but if you breathe in and your chest is going up and your neck tenses up, this neck is going to be involved and gets tight. The shoulder, along with that, if you keep changing the breathing patterns, it will create those issues. Along with that, because your breath is involved and your rib is involved, you will have core issues very likely. Because your core issues are involved with it, the deep core muscles, that's called like the oblique muscles or transverse abdominis, they will have to be affected, and that may include your low back and everything else. A lot of times, another thing is digestion. When I see digestion issues, because the rib cage is involved and your diaphragm or breathing muscles are not working so well, affect your digestion because it's not moving the kind of like the large intestine and small intestines very well. Give me 1 second, guys. I kind of lost a little connections here just to make sure I am not losing anything. Okay, that's good. Give me 1 second. Okay, here we go. Just so I can see everyone here. All right, cool. And so next one, shoulder blade. Sorry about that technical difficulty, guys. So shoulder blade. So the shoulder and shoulder blade is very often involved with the neck. So Danny slightly touched on it, where your trapezius muscle, like everyone has probably heard what traps are, where it attaches from the neck of the head to your shoulder blade and also your collarbone. those muscles are involved for a reason. Whenever you move your shoulder blade, it does affect your neck, or whenever you move your neck, it affects your shoulder blade. So sometimes when those neck and the shoulder is not working well independently, it starts to glue together, and you have people that kind of shrug their shoulder, or when they move their neck, the shoulder shrugs as well. Another thing is jaw. Then you talk about stress. You probably heard it from your dentist before, saying, hey, do you grind your teeth? And he's like, the dentist is like, yeah, it looks like you grind your teeth. And you like have this unconscious tension in your jaw. And the reason I'm bringing this up is you may not have jaw tension, like you might not feel it, but what you may feel is neck pain or shoulder pain that is involved with that. Another one I want to talk about is your eyes. Right now, more than ever, at least for me, is I'm staring at my computer so much longer than ever before. And most likely, if you're not, I might be watching Netflix or something else, where we're looking and we're straining our eyes so much. And if you look at a person that's really tight, their eyes are like laser beam focused sometimes, right? They're like this, right? Well, my eyes look weird, but anyway, if you're laser beam focused too much, sometimes your eyes get stuck with your neck. Because if I move my neck to the right or the left, my head should stay in the same spot. But if you'll see some people, if they move their eyes to the right, they'll kind of move your head together with it. Or if they move to the left, they move the head with it. That means your eyes and your neck cannot separate anymore. And when things glue on more and more, it tends to have an effect. If you are doing much more computers now, sometimes doing eye exercises can be very helpful. Last one, facial muscles, right? I put this because a lot of facial muscles has some connections to these parts of the neck. But thinking about facial muscles, when you see a person that is, let's say, for example, having a difficult time, let's say, let's say right now, and you're kind of mad, angry about the situation, you're angry, mad all the time. Certain facial muscles are going to be always on. And if you keep doing the same thing over and over again and don't let something else do the job, you may create this pattern of this type of neck tension all the time. Being mad is not a bad thing, but if you're doing it all the time, you might form some form of repetitive pattern. So I want to talk about this cogwheel concept here. So if you've ever seen a cogwheel, our bodies are like joint by joint. A lot of times it's working in a cogwheel concept. And I'll kind of play this video real quick here. And I'm going to about, yeah, there you go. So if you guys can see here, a cogwheel is very interesting, where when you move the wheel in one direction, the other cogwheel is supposed to work, is supposed to move in the opposite direction in order for everything to work. To happen, not supposed to, but ideally I would like it to happen in the body parts too, because you need counter rotations in order to move and stay stabilized. So if I'm going to keep playing here, if you can see, and this is the arrow here, where you can see how the rotation's in the opposite direction. This is a good thing. I want to make sure I say this. This is a good thing when you have this in the body. Because if you don't, that means the body parts together, and if they go both the same direction, it's starting to glue together. Unless it's the intended movement, that's fine, but if it's not, that's when things get glued together, and then you start to feel a stiff neck. And the reason why I created this webinar, and it's called it Freeing Up Your Neck, is not because I want to make you free. Well, I do, but like not in a sense like you're going to fly away with this great cervical spine. It's understanding that the neck sometimes compensates for something else. So if you understand what's happening in these relationships, you may feel freer in your neck because it starts to move independently from other body parts. So I'm going to quickly go to the right side here. So I'm going to go here so you guys can follow. This is an example of a cogwheel effect in your body. So if you take a look here, the pelvis tucked under, right? And the upper body here went the other way, and the neck went the other way. And if you look at it, it's a cogwheel effect. Now, in this picture, it presents, in a way, a bad postural pattern, right? But I don't want you to think it that way, at least in this is a cogwheel effect that is working in the head, upper body, and the low back. this is a good sign, right? And then the other way around, this person on the right side, so we're going to go one more here. It is tilting forward, and the chest is going up, and the head is going the other way, right? These are cogwheel effects that's happening, and these are working separately from each other, independently from each other, and that's a good sign for us, right? In a regular person, or if you look at it from a traditional standpoint, if you take a look at the right side, you'll think it's like, it's a great posture. But that's not how I would think posture, which could be another time. And I'm going to stop right here from that because it could be a long conversation. But in a sense, the point is, if you have a cogwheel effect in your body, this is a good sign. So understanding the relationship between the neck and its adjacent body part is a key to a looser neck. Because what often happens is a glued neck. So we're going to go into self-assessments. So this is a self-assessment, and of course, I have like the weirdest face in this case. But anyway, I love this assessment that we're going to do on, and you're welcome to try it. Just a disclaimer here, we're not trying to treat anyone. We're not trying to do anything. So if you are having pains or anything like that, try to stay away from it. And if you do need to work on it, and you want to work on a neck and you are kind of confused about it, just talk to any of us to see if we can help you further. But we're going to do 3 self-assessments now. And this is the first is neck rotations, second is thorax rotation, meaning upper body rotation, and 3 is neck shifting. And I'm going to try to go slow with this one, because last time I was practicing with Danny, I got too excited, so I just went. So if I go too fast, someone wave at me or something. I'm trying to see the videos and tell me if I'm going too fast. But I'm going to first do the first video here. So the first one is just turning your neck left and right. And you can do this if you like, along with it. But I want you to turn your neck right and left. And the important thing is the neck rotating independently from the upper body. So if you move your neck to the right, if you move your neck to the left, and you can go as far as you like, however you want to do it, the neck should rotate, and everything per se should be somewhat stable, not moving, right? So there are certain compensation that happens that you see, and I'm going to talk about 2 in this video. You can see how the neck and thorax kind of rotated together. I'll do it again. Where when you rotate, the upper body rotated together. That's when I know, to a certain extent, the neck and the upper body kind of got stuck. It doesn't know how to separate each other in order to move the neck independently from the shoulder or the upper body, right? That means it's glued on, right? And you've probably seen this many times before. Let's say you slept the wrong way, or you saw someone that are having neck issues. They kind of move like this, or like kind of like this, and you're like, oh, is your neck okay? And it's either you're like, oh, I have a stiff neck, or you have a bad neck, or you slept the wrong way, right? Other things that could happen, this is kind of like a bonus one, where if you take a difference here, you'll see how my back is arching to get it. It's because my head and my upper body got so glued on together that it can't rotate. So I use my low back to rotate this. Take a look. So these are the people that would have a stiff neck, but also have back issues. And whenever you're kind of, let's say you're turning your neck to look behind you while you're driving, and you just like, you can't help but like not move your neck, but you move your whole body and drive, right? And then you're like, oh man, my back is stiff after driving, or once you just do that. They're just common compensatory patterns. Okay, that was assessment number 1. If you found something with that, just keep in mind what happened to you, because the important thing is awareness first, and I'll talk about that in a second. The second one is called thorax rotation. So this time, you can barely see it with mine. So I should have done a little more exaggerated so it's easier to see, is your neck, and I'll just do it myself so you guys can see it. Hold on, I'm going to unpresent it. All right, you guys should be able to see myself here, is you're going to keep your head fairly straight, and you're going to try to move your upper body while your head is fairly straight. And you're going to see how much you can rotate without this moving. Now, many people can compensate out of this, right? And I'll say in the video in a second, because a lot of people, as a compensation pattern, is they will move the shoulder. So if I move from my upper body, meaning my rib bones, you will start to feel how your oblique muscles will kind of contribute to it. So as you're doing it, you'll notice how things are kind of stabilizing here, like activated muscle, as you keep the head straight. Common compensations pattern include my shoulder just moving. So I'm kind of turning my shoulders to get it and rotating. This is not a good relationship between here and here. You're looking at how you're compensating the shoulder to kind of try to separate. Another compensation pattern along with it is when you are doing it, you are not just using the shoulder, but you're using your hips to do it. So you can't really see it here, but imagine I'm moving my hips to do it instead of using my upper body. So these are some common patterns that you may see during these assessment patterns. Hold on, guys. I'm going to go back to the presentation now. All right, hold on, guys. All right, good. That was assessment number 2, and I think I talk about compensation patterns a little bit here. So give it a second. So, that's the next compensation. As you rotate your upper body, your neck comes along with it. So that also means as you're rotating your upper body, your neck kind of gets glued on, and just knows that the neck is not aware what's happening to here. It's just sticking with it. And I'm saying in this video, make sure you're moving from the rib cage. It's a very important point right there, because a lot of people will compensate from the shoulder. Now, last one. I'm giving you 3 for you guys just to have an idea. Last one is a neck shift. This is the weird one a lot of people have difficulty doing. And I know I have given to some of you possibly that are here, is the neck shifting exercise. So if you ever kind of have if you're into Bollywood, and I hope I'm not being stereotypical or saying the wrong things here. If you're into Bollywood, imagine me, I'm kind of having this hand here, and you're making sure the upper body is not moving, and you're shifting your neck kind of like a typewriter to the left and right. If you are trying to do this right now, I can't see everyone's camera. This is incredibly difficult if you've never done this before. Incredibly difficult. For those that you can do, and I've seen you doing a good job, great job, and possibly some of you are people that I've worked with. Sorry, I just got a nice little chat, and I don't think I offended anyone, but anyway. So if you're not into improving your neck, this is a drill that I would give, where you are looking at yourself, and if you're looking at the camera, try to do it, right? Where you're not moving the head tilting, you're shifting the neck to the left and right. And common patterns you see with is your upper body starts to go with the neck. You notice you just can't go, the body starts to compensate by doing so. So whenever an individual is doing a neck shift, this is much harder than you think, because you don't really think about these movement patterns when you're just walking around or doing things in everyday life, but your neck is such a mobile joint or body part where it needs rotation. So it just needs rotation, side bending, and also up and down. It's a very, very three-dimensional, such a mobile joint. So whenever we include rotation, going side to side motions become very, very important. So many individuals they can't do this, right? Same thing, it's the disclaimer, this is an assessment pattern that you're gonna do, and you are gonna utilize that to help yourself. So I'm not gonna give you guys any specific exercise, but it's concepts that I want you to take away from here. Is when you're doing these drills or these assessment patterns, the assessment becomes the exercise. What I mean by that is if you notice yourself, let's say you're rotating your upper body and you notice your neck go along with it, that is a neck and an upper body that is glued together. That means this guy or this head/neck is not independent from the rib cage. So guess what? It's gonna feel stiff. right? It's a relationship. It's a relationship that depends on each other, that has little ability to kind of do more than what it needs to. So that's a stiff neck. So once you become aware of it, because being aware of it is number one if you want to move forward. You can't just do a subtle exercise, or you can. Some exercise will just help you, but becoming aware will give you to the next step because it'll internalize in your brain or up here, and you can actually move forward. So if you do notice that you compensate from some of the things that I talked about in the video, what you start to do now is you do the movement, you're going to go slow and see if you can do it with less compensation pattern. You'll be surprised how much they could help you, right? If you are having trouble, just feel free to ask for help because there's many things involved with this. So sometimes, let's say you're trying to shift your neck this way, but you can't hold on to your body. It could be because this side of your oblique muscles or core muscles are not stabilizing or anchoring yourself. So it just doesn't hold on. But if you're anchoring yourself with some of the muscles here, you might be able to move it because a neck has to feel safe in order to move. Like Danny said, this here is the ground. If the ground is not stabilized or aligned well or working well, whatever we want to put, this thing here is not going to want to move. So it's a relationship of each other. Okay, so I hope I didn't go far up the deep end here, and I hope I wasn't too fast or maybe it's too slow, whatever. But we're gonna go into now because I know the neck is very, very complicated. So if anyone has questions about it, I'm really happy to see you guys. If you are not asking questions, but I would love to see some of your faces. But I do realize some of yeah, I see some of you, so thank you for that. But yeah, does anyone have any questions about the neck? Hey, Naftali, thank you. There you go. Oh, I see Sayun. I haven't seen Sayun forever. Ilana. Anyone have questions? I thank you for giving me your video. Like, love to see your face. Thank you, thank you. See, thank you, thank you, thank you.
Happy to see all the faces in here. Huh?
Hey guys. Hey guys.
I have a question, I suppose.
Go ahead, Paul.
I just hope it isn't too complex. But I just understand the scalenes as an accessory muscles that if you can't like expand forward, they help you expand the lungs by pulling everything upward, correct? Like first and second rib to get air up here rather than forward. Correct? Right. So then we talk about like reaching, and the serratus kind of pulls the rib and puts it back in position, like the first rib or whatever, right? So it's like an opposing muscle that helps maybe inhibit the scalenes. So I'm right so far. All right. So, but then we also talk about how can I get this expansion, the apical expansion, rather than this. So now I'm wondering, like, to inhibit the scalenes, which direction would I go? And I know it's probably a multi-layered thing, but would I, because they're two kind of different things, would I be reaching or would I be focusing on apical expansion or both? Or, that's my question, I guess.
Yeah, that's a great question, Paul. So I'm gonna word it differently to see if some of us can kind of follow, because it's a very specific question. So Paul, correct me if I'm wrong. I'm gonna repeat some of the parts that you said. Is the scalene muscle, which is a muscle from the neck going down to your rib bones right here, is part of the neck muscles, but also it can also help with breathing. So if you've ever ran really hard and you're exhausted, your breath goes up. This is a product of this muscle called scalene, right? So if an individual keeps breathing through the chest upward this way, they often will have neck tension, right? Some people might not even notice there's neck tension, but you will have neck tension, if we assess those individuals. So in order to inhibit, meaning to get that relaxed a little bit, what Paul is saying is using the muscle right here. This is called the serratus muscles. If you ever heard the boxer muscle, this is a boxer muscle where it stabilizes shoulder blade and your rib bones. So these muscles help pull the rib cage down in assistance. And what happens because of that, these scalenes relax. Now, Paul, jump in anytime. When you're actually trying to breathe in where it's not up, but really forward, how would he do that? Or how would we do that? Is that somewhere close to what I?
No, yeah, exactly. Exactly. Yeah, that you explained it perfectly.
So the key point for here is understanding when and why scaling breathing happens, why neck breathing happens. Neck breathing is an accessory, meaning it's a secondary compensatory breathing pattern, not compensatory, secondary reasoning to have a breathing pattern. So let's say you're working out hard, right? And you need more air in. So let's say your diaphragm muscles or normal breathing muscles are not enough. This is when you start to use these. It's not bad. It's a survival mechanism breathing pattern, right? So it will usually come with higher intensity types. So let's say you're anxious, you're kind of, that's going to increase that. So if I want an individual to breathe more here so I can shut these down, it also comes down to the intention of the breathing. So let's say I'm breathing, and if the person's breathing out and you tell them to breathe out and breathe in, and they're doing this way, like when they breathe in, they're breathing so strong and hard, guess what? They're going to probably use this more. But if I tell them to breathe out and I tell them to breathe in quietly and slowly, they might just expand slowly, which takes away, at least because of the intention's different, it will tend to help breathing into here, right? Now, if they breathe into the stomach, there's a different reasoning behind it because they may not have obliques enough. But from a kind of specific cueing standpoint, I would just make sure and say, hey, do you feel your muscles that we need to? And now breathe in slowly and gently. And for people that work with me, will often hear saying, make sure you inhale or let the air back in, not force the air back in. And that allows the chest to expand the intercostal muscles that are very specific to here. Does that answer some of the question, Paul?
No, it answers it perfectly. I mean, you talked about like why the serratus would help, and you talked about why the apical expansion would help, but also when to do which, or if you should just use both in combination or something like that. I know you can't use both simultaneously, but maybe do one and then the other.
Right.
Right.
Right. Yeah, that was a great question, especially if you're into the breathing world and talking about that kind of stuff. Anyone else? I know a lot. We kind of not triggered, but created some interest in the neck because I'm assuming a lot of us have a neck tension. So does anyone have any questions? Adele or Ramina? Who do I go
Yeah.
first?
Hey.
Let's go Ramina.
So I was hoping not to be among the first because mine might be complicated. It's about a client. She was in a car accident a few years ago, and she has her C4 to C6 fused. And she's had multiple shoulder surgeries, just, trauma. But nowadays she suffers with just shoulder arthritis. And my simple question is, what might the shoulders be making up for if C4 to C6 is fused? Because I've tried breathing, reaching stuff, anything that involves her shoulders or even being on her hands or reaching, it just hurts her shoulders. And like by the time I try to position her better with her serratus, it's too late. Like she's in pain. So like I don't touch it. We just do legs, we do push-ups and other active things, but nothing where I can get her to breathe into her flat back.
Right.
So that's where I'm stuck.
Yeah, that's a hard one. That's a hard one. So when we're thinking about rotator cuff and the shoulder, does Danny want to say something?
No, I think there's a lot of answers to that question. Like you said, just a rotator cuff, because C5, C6, and C4 to all the way to C6 that's a rotator cuff. So who knows what kind of compression is happening around that area that's crushing those nerves that feed the shoulder. So commonly, like when someone has a herniation, C5, C6, you're already going to have issues around the shoulder as far as elevation or reaching or something going along that area. So as far as the fusion, there's nothing you can do that you cannot reverse it because they might need that support. But what you can do is just make sure that not overutilizing that neck. So referring back to what Kento said before, it's just in the inhale, make sure they don't inhale too much from here. Make sure they inhale from other parts of the body to not bring extra pressure to that side already that's already compressed from that fusion itself.
What might be an exercise that you give her to help her breathe better?
form one just teach you how to breathe out, right? Just to breathe out, and then kind of like, like Kento said, that with a quiet breathing, that tension, just like nice and quiet, exhale and feel other parts of the body and not just here. Because you're gonna see it. They might not feel it, but you can see the neck popping out, right? When they're breathing in or they're breathing out. You don't want to see that. So just cue her to do quietly. And then see how that affects. You can also reposition the shoulder in different ways to see to try to take away some of the compression that might be happening, not just along the spine from the fusion, but along this way too, right? Because the brachial plexus starts in here, right? But it also expands and it goes almost like a noodle soup all along here, right? So make sure like, you reposition the shoulder to take away any extra compression that might be happening due to compensation along here.
So you're
That would
saying
be
it
my
affects the length of a rotator cuffs, you said, the fusion?
exactly, because the
So
fusion
let me jump in for a second,
Yeah.
because I know Ramina well. At least I think I do.
Of course you do.
So so Danny said really well when he talked about C5, C6, because C5, like C4 to C6, right? So C5 new root goes right to that rotator cuff and the shoulder joint. So it's not very surprising that she has shoulder arthritis. Now, Danny talks about the fact that she has a fusion, so you can't do much about that really, right? But what you can give her are things that moves around that area so that maybe the nerve in these areas gets a little bit of massage. So I like the fact that you've been doing like lower body stuff, push-ups, but the key thing that I would want from this individual is one-sided apical expansions, more so. So there's a manipulation going on here that will affect what's going on here. So when there's air coming into here, this side gets shortened, while air's coming out, this side gets lengthened, and you kind of go back and forth with it. Because you can't do anything from C4 to C6, so there is going to be effect to it. So what you can do about it is really just work on the things that you can work on to influence here. So like what you're doing with the leg exercise, it's perfect. I would actually go more single leg, so she can actually, or she or he can put more weight on one side, so it does have some form of effect up into here.
Okay, yeah. So, I mean, aside from single leg, are there any other positions that would achieve that apical that don't really involve the putting weight on the shoulders?
Besides standing?
Yeah.
Besides standing, I mean, you can put them on the wall. I mean, laying down is one of them, but I know you said like anything shoulder related tends to be affecting her.
Mm-hmm.
But standing is the best one right now, at least for her. Hopefully, if there's other ways, we got to figure out to talk about it. I mean, half kneel is another way, unless she's having other issues that we need to.
Okay. Thank you. Yeah, that makes sense.
Yeah, of course. Adil, I know you had your microphone on. Do you want to say something?
Yeah, please. It was just a follow-up to the question prior to the last one. So in instances where people are kind of stuck in that hyperinflated state and they're really relying on neck musculature to breathe, I've seen that it's been really challenging for people to get through like a full exhalation without really needing to go right back quickly into an inhale because they feel like they're running short of air, or that inhalation seems to be like their survival tactic. Do you have any suggestions on how to navigate around that for people who, are building their capacity to exhale, but it seems like every time they inhale, that strong inhale overrides whatever you're trying to build for their exhale?
Got it. So you try to have them exhale because they are in a hyperinflated state. So they're kind of like this position, or the air is really inflated.
Yeah.
And as you have them exhale, they tend to go back into inhale, even though they have much more exhale to go for.
Right. It's like it's too scary to go further into an exhale. It's like they need to get right back into inhale because everything seems too daunting.
Right. So I can only go general with this question, or at least I think a general answer, or I'm just predicting, is if they probably doing it because the exhale doesn't feel supported enough. So they don't have the proper or the enough capacity or connection with the exhalation muscles in order to feel safe to keep going. So it could be a state of mind too. Like when they go into exhalation at too much, they feel like they're going to choke, or they feel like it's like too much, or it's like this pressure that they feel. So it's more likely it could be a biomechanical and physiological thing, but another way to put it is, if that is the case, you want to give them as much support system to help them exhale. So it doesn't feel like as much of an effort, right? So, if we're talking into the direction of Posture Restoration Institute, you might go into like a kneeling position where you hug the knees, or you go into an elbow, like on your elbows and knees, so they're in a more better position to exhale, right? Or you help them. You put your hands on them and say, hey, can you just breathe out? And I got you. And I got you. So you're just giving them less effort to do, to give them some ways to do it. And you just kind of practice with that. Because for them, it's possibly, one thing is the safety issue. Some people can do it because they're like, okay, I know I have to do so. They practice. But for those that can't do it, there's more chance that they just don't feel safe enough. So you just want to give them some form of hand. You support their hand, and I'm saying that from a figurative standpoint, to push the air out with them.
Okay, got it. That was helpful. Thank you.
Of course. Anyone else? I know a lot of us got neck issues. Don't get me wrong. I know. No questions. If you want, you can put it in the chat privately to me, and then I can answer for you. I won't say your name. I'll be anonymous. I'll just say Mr. X or something like that. No one else? Oh, Nicole. I see Nicole. Or John. Let's go Nicole first. Sorry, John. We'll go back to you.
Hi. Great talk as usual. You guys talked a little bit about posture beforehand, and I just wondered, like some of the exercises you might give somebody for their neck as far as when they're in posture, posture being dynamic and being able to move in and out of different positions. Do you find a lot of benefit for people that tend to be stuck in one position, like forward head position, they're pushing their chin forward? If they work through the day and let's say they didn't get on the ground and worked on different areas of their body, do they find benefit in the exercises like chin back exercises and things like that to help them come out of some neck discomfort, or are those pretty futile if you're not working on anything else? Does that make sense?
Yeah, of course. I get it. So a common thing that I'm assuming Nicole is saying is for people that are sitting for too long and their head just kind of keeps going forward. So if there's so much like this, is it useful to kind of just go into this like chin tuck position here? And is there benefit to that? And I want to say there is. And I say I want to say, and that is some form of specific reasoning behind that. The only thing that I might have issues with that, and it's just really more through experience. And if someone is more can show me a more comprehensive way of figuring that out, I'd love to hear it. But when an individual kind of is here and then go back to here forcefully, it often comes from not a great place. So I'm going to go back to the concept that we just talked about of how the neck is in relationship with other parts of the body. As they bring the neck, so they get glued. So if they're here, they're here and their neck gets glued. So when they come back up, they bring the whole thing back versus it's just the neck that you need to do as a possibility. So it's not independent from each other. So I have nothing against bringing that posture back. It's really just about how well you do it again. So like when we talk about cogwheel effect, there was like this picture on the left and the right where it's like it looked like bad posture and good posture. I don't think it that way. It's like if you cogwheel effect well both directions, the brain will know how to stand or sit like with minimal effort straight, because it knows how far back it is and how far forward it can go. So that middle is just good posture.
Awesome. That makes sense. I see it a lot in classroom where people lead a lot with their chin, so I give them cues for the chin or their head. But I could see that may not be as effective as I'm telling myself it is. So that's good information.
Right, and there are times that it is helpful, Nicole. That when a person's going, like right now, for a lot of us, we're so much in our TV and our computers. So some people are like this all day. So just giving that opposite direction itself is helpful. But what I noticed is it doesn't progress beyond that, and that's just my experience and my understanding. So I hope that's helpful.
Yeah, that is. Thank you, as always.
Of course. John, over to you.
Okay, yeah. One of my clients is a psychotherapist. And when I first picked him up as a client, He's really stiff. He's got a lot of flexibility issues. Specifically about his neck and his trapezius. He was claiming, because of his profession, he thought 80% of humanity stored their stress in their trapezius. You know if that's correct?
I think that's a very, very general data point. It's just kind of telling me, like, it's, I don't know. I don't know. Like, it almost tells me it's like, it doesn't feel like there's a lot of good data to that. I would think there's a lot of step layers into that question or answer. I would say a lot of people do hold their stress, and a lot of us do represent that the trapezius will be tight, right? But I think making that correlation from like stress equals trapezius, I think it's kind of like I think it'll confuse a lot of people afterwards. Instead of saying, okay, well, stress will lead to survival mechanisms. Survival mechanisms tends to mean that I'm going to be in a certain pattern in order to survive. And for some people, they tend to do this all day, so the trapezius will get tight. So yeah, and like I don't think it's incorrect, but I feel like it's just not the strong, like there's more layers beyond that leads to that, I believe, John.
Okay, thanks.
Of course.
Yeah, I think so too, Kento. I think it's just too specific, because sometimes, stress doesn't just reflect itself in the neck. Sometimes, chronic pain. Someone that has a chronic pain in the knee, someone that has a chronic pain in the ankle, on the shoulder, or anywhere, like, right, when they're stressful, it flares up. So I think it's just that assumption that's just in trapezius is too biased. So stress is just general. Whenever you have stress, whatever you have already compensating, it's gonna come up to a level that it's gonna express itself as pain. So, great question.
Yeah, it's a good question. It's a good question. Like when you said that, like I kind of think about, I guess I'll use myself as an example. It's like, oh, Kento, you're Japanese, so you must be good at math. Like there's not enough.
I thought you were.
I am good at math, so it fits it. But it's not because I'm Japanese. It's because the environment and the educational system, they talk about like the math education is very quick. Like when I remember when I was a child, like in school, like what I learned in the regular weekday schools, meaning like in the schools in the U.S. and I'll go on the weekends in Japanese school. The Japanese school of math is about 2 grades ahead than the U.S. schools. It's not that I was good at math; it was just me that I was exposed faster. So for compared to a lot of people, math was easier for me. But it's not because I'm Japanese. It's more like because these things happen that led to me good being math. So like when I hear like stress equals trapezius, of course trapezius will have a big reason for me. And John, just get extra bit of anatomy in here. Hold on, Seiyun, you just gotta mute yourself. Thank you. So the cranial nerves, right? So trapezius is innervated by cranial nerve 11, the accessory. No, wait. Yeah, the accessory nerve, right? So the cranial nerve comes from the brainstem area. The brainstem has a lot of survival mechanism parts of it. So like it talks about respiration in regards to heart rate. So it is related to survival, a lot of it, right? So because the vagus nerve also, it comes from the cranial nerve and it connects by the brainstem. And it's autonomics, right? It helps you rest and digest. So when survival mechanism comes into play, those nerves are affected. So the trapezius is, yes, more likely to be affected, but not because it's stress. It's because it's related to survival and what it's related to, where the brainstem, like where it comes from the brain. So I don't know if that's helpful, but
yeah, that makes sense. Yeah.
Anyone else? I see people kind of starting to come out, and I'm actually over time, which is that's funny. Anyone else?
I think Kento, they wanted to hear who was going to be next week. You mentioned it at the beginning of the webinar.
Oh yeah. So for next week, we're gonna keep going, but I'm gonna host this time, not gonna, or what do you call it? Yeah, host a podcast in a sense. Like I'm gonna have this guy named Alex Raskover. He is a social worker, but he also works in relationship psychoanalysis and also attachment theories. And he works, with me well, where he understands how our some of the psyche stuff also affects how the body positions or brain position, not brain positions, like movements gets affected. So we're going to talk about a little bit about these things, how we are dealing things in COVID, but also we'll probably have a Q&A together where we'll be like, okay, what do you see when this happens? And what do I see when this happens? It's kind of like a sharing type, but I thought it was great. It's very selfish of me too, because I'm interested in that kind of stuff. But I think for those that are interested, I think it'll be a great webinar. Oh,
Hey,
so you
Kento.
want to say something?
Yes. Last minute question. Have you ever experienced any clients with too much serratus activity where it compresses the ribcage laterally and prevents your proper breathing mechanics?
Oh, that's interesting. So then it could be the serratus activity. It's more likely how the serratus is being utilized, I would say. Okay. So it might be the fact that you're right. It might be the fact that it's contracted too much where, let's say the serratus is right on the side, right? So it becomes it bulked here, it pushes in this way. So they're over this way, right? So that might be a reason where they're not actually utilizing the serratus where it pulls the ribcage this way first. They might just be using like the scapular ribcage too much. So either you need to stretch it or you're not using the serratus to open up the ribcage. But I don't think it would be like if it's a good question.
Okay, what are some stretches that you can utilize?
But what are some stretches I utilize with that?
Yeah.
I'm not sure if I'll do any
in the
stretching.
case that serratus is too overactive.
Right. If that is the case, I'm not so sure. I'm not really sure if serratus overactive is common or I've seen it often. But if I do, you would do something so it just opens this rib cage more. So it allows you to open sideways, not this way. So when you're with those people, what you're talking about, breathing wise, how it will look is the front to back expands, not side to side. Right, so the bucket handle effect is not there enough. So that's what you want to really work on. So if anything, if you're feeling one side, just work on one serratus so the other side can expand. This person's compressed both ends, so that means they're just compressed. They need to decompress somewhere.
Okay.
So I don't think a stretch would do it. A stretch would take away the need to compress. But just letting the serratus let go a bit, maybe retract it as you're doing it to open the other side. A stretch would not do its job because it's the rib cage we're talking about. It's the breath that we're talking about. It's not the serratus. We're talking about the consequence on the breath.
Thank you.
You're welcome. All right. I think we're good, Denny. We did
Yeah, I think we covered all the topics. I think we had a good crowd today too.
Yeah, we got some people that I haven't seen in a while, so it's so nice. Anyway, so next week we're gonna keep this up. I mean, who knows? I really don't know when we're gonna have a normal life. So this is my normal life right now. So next week, Tuesday, 2 o'clock, we'll have this, and then we're probably gonna do a wrist after that. And you know, for as long as I can talk, I guess I will keep doing this, or when I get tired of it. So guys, thank you so much for coming. I'll see you guys next week if you're joining us.
Hey, Kento, quick question, last minute question. Do you have the recording?
I just did my I just did my closing caption, dude. What the hell? Go ahead.
Last recordings from previous sessions. Do you have it available by any chance?
I don't know, Danny. Should I give it to Sayon? Because he just interrupted at the last second. I closed it.
You know,
closed the session.
Like a good guy.
Go to my YouTube channel. It's there.
Okay.
Yeah.
Take care. See you. Bye, everyone. It was so nice to see you all.
Bye,
care, everyone.
Be safe.
You too. Thanks for watching this video. If you found that helpful, and if you now are thinking that I wonder what else this person can help me with, please go to our website at www.kamiyamapt.com and find other free contents or apply to our free discovery visits to further see if we can help you. For any further information, please email us at info@kamiyamapt.com. Thank you so much.